Joining me for this episode is Adam Horowitz. He's principal owner of COVID-19 Investigations. He's working with people and organizations just to find ways to deal with this pandemic during this time and find ways to safely go back to work and function. Thanks so much for joining, Adam.
Thanks for having me.
So tell me a little bit, if you can, about yourself and your organization, just a little background information so viewers have a better understanding.
I have a healthcare administration master's degree, and I started at the VA. They have very long lines, and so it's making sure that people get care fast, and that is seamless into COVID-19. The first part of tracing, which is what we do, contact tracing, that's where we got our start, is making sure that you can outrun the virus, contacting people as fast as the virus can spread. That's key to what we do. So first thing when we contact somebody, and this is like a public service announcement right here. If you get contacted by your county health department or your state health department, first thing you should do is verify it's not a scam. So ask them for a way to call in instead of being called, right? Verify the phone number they give you is, let's say, the county health department that is listed on Google, like a third party verification, and then go ahead and call that number, ask for somebody's name or a way to get back to that person so you can have the conversation. There are scammers out there trying to take advantage of this situation, and you shouldn't be one of those.
Adam, can you tell me a little bit, before we go too deep into this, more of a definition of what contact tracing is for people?
It starts when people test positive for COVID-19, which is the disease caused by the virus SARS-CoV-2. And when you test positive for that, the public health department will contact you, hopefully immediately, and give you three things. They will tell you how to help yourself. They will tell you how to make sure that you, your loved ones, and the people around you are safe. And they'll let you know how and what to expect at the end of your time there. But very simply, they're going to tell you to isolate yourself, either through quarantine or isolation. If you are positive for COVID-19, they're going to ask you to isolate, which means if you're in a house, you have to be in a room by yourself, preferably a bathroom by yourself, if possible, and you have to stay there for a certain amount of time that's calculated by the person on the phone. If you are asked to quarantine, it means that you are a secondary contact. You were exposed to the virus, and as a precaution, in order to stop the spread of COVID-19, then they're going to ask you to stay in your house. Not necessarily to isolate, be in one room by yourself, but to just stay in your house and monitor your symptoms.
So how are these government entities or organizations that are contacting people to find this out, or companies that are working on contract tracing apps and information, how do they use that information that they gain when they're also trying to help the public, but also try and inform how to combat this virus?
They should de-identify the information, which means that if there's 10,000 people with the virus in a certain state, they should strip it of any information that would identify you or another person specifically. So they can pool the information by de-identifying it, taking out all the identifiable information, and then use that pool of information to help them with statistics and data science and create visualizations for the decision makers, the governors, the county, mayors, whatever it may be.
Tell me a little bit more of how you feel your background has prepared you for this.
I talked about the healthcare administration. That's a big part because you think efficiently, and this virus is super efficient. It doesn't have any compassion. I've heard people describe it as a speed demon. That's key to this. And the other half of it is that I've spent the last 10 years in call centers, managing call centers. So those are the basics that are really required in order to keep up with this virus and initiate contact within the first 12 hours of symptom onset, which is the ideal time in order to quash the virus. If we can contact people within 12 hours of symptoms, you know, if meaning 12 hours of when they get a cough, a cold, a runny nose, the flu, like flu-like symptoms, maybe loss of taste or smell, then we have a very good chance of helping out, the county, the state, whatever we're talking about here. That first part is speed, and that's where the experience comes from. The second part is gaining knowledge about the virus, which has been very difficult to do. Uh, we could we could talk about that for hours, but there's a lot of misinformation or disinformation or inaccurate information out there right now, and that's been a very tough challenge to work with the experts and figure out how to get the proper information for our own technology and services and also to policymakers.
So let's talk a little bit more about that, right? So people may be infected, they think they may have been in contact with someone. They're trying to do what they can with all this misinformation out there, may it be, or just information that's not vetted properly from different organizations, from news sources. Do you have any advice or thoughts for the everyday person of how they should be looking at this, approaching it, and looking into making sure they have the right information?
It's easier to start with what you should not listen to at this point. Um, the news is almost all what's called preprints, meaning that the study was done and it's being printed on a specific publishing server, but it doesn't meet the gold standard. And no one in another time would ever really use this or see this study. It has to be peer reviewed, and many studies don't, are changed after peer review. I'll give you an example. Famous famous publishers. I'm not going to name them here, but probably the top two in the world have recently retracted very impactful studies, and they did it silently. Almost nobody noticed. And my mother called me super nervous that one of these journals put out a study said that 88% of people don't survive if they're put on a ventilator, and she's over 65, understandably so. It was very unnerving for her. 2 days later, somebody peer reviewed it. The journal sneakily went in and adjusted the number to 25%. That the news cycle had already started on the 88%, and people were already scared. So the first thing I would tell you is that 90% of the things that I see, that's a rough number. I haven't done a study on it. In the news is preprints, and it's designed to, clickbait and to get out there first, be the first in the news cycle to report on something, and that's not really what we want right now. So I would say don't go there. Um, as far as the official WHO, World Health Organization, and CDC, you can always rely on them. For me, they're a little too slow in putting out the news and putting out the studies that are relevant to me, and also they make mistakes. So what I've done is I've put together. Right now, we have about 100 epidemiologists, infectious disease doctors, public health policymakers, biostatisticians, data scientists, and pharmacology. All of them are researchers or in the field itself. And whenever there's a study that I think that I can easily pivot my technology or my service to, I send them the study, have them peer review it, which takes time. And then I'm able to present that to policymakers, show them how I can use that in the field. And that's what we do internally.
I mean, it takes time, but this has been going on for quite a while now, depending on where you've been in the world. So does it make more sense to take that time and really fine tune it and figure out what you're dealing with rather than just putting the information out there and seeing what comes to fruition?
Right. Otherwise, I feel responsible. Right. I'll give you an example. Okay, I'm in contact tracing. I think everyone's probably heard of it, right? By this point, they've touted it as the way to go. We need contact tracing to get out of this, right? I've heard that a lot. Um, Contact tracing is really not that effective for respiratory viruses. I'm just being, I'm a contact tracer. It's really, it's shocking that so much is being put into the basket of contact tracing will save us. Um, it has in certain countries. China, contact tracing was amazing, and they did a good job. I mean, I don't know if I'm gonna get censored for saying that, but Singapore, South Korea, New Zealand, all those countries use contact tracing effectively, um, in order to in order to quash this virus. So I'm going against the tide and saying that maybe it's not as effective. But I care about the United States. I care about Florida because I'm a Florida boy. I care about Texas. I care about California, New York, Tennessee. I care about Americans, and we don't want to. I would tell you more than 50% of us don't want to be locked down, and that's what a contact tracer is going to ask you to do. They're gonna tell you that you have to lock down. It's a targeted lockdown. That's essentially what it is. Um, People need to make money. People value their liberties more. People um, have social problems, right? That this lockdown has caused. Emotional problems, psychological problems are coming out. It is very difficult to lock down again if somebody just asks you, say, you know what, you might have been exposed. Why don't you take 14 days off of your life, and after everybody else gets to walk around, you got to go back into your little hole, and um, that's what they're asking them to do. It's a very difficult thing.
It is really difficult, and you said contact tracing is a part of it, and but maybe not the only part. And there's a lot that people cherish their freedom and their ability to do things and make their lives for themselves. But what else is there with the overall landscape, of the pandemic? We're talking about businesses, we're talking about individuals to being prepared for now and in the future when we don't know, if another wave, as is being said, could come. What are preparedness ways to make sure you and your family and your businesses are kind of in as best of a position as you can?
You have to mentally prepare yourself. That's first and foremost. I was telling a story before we got on today how my daughter got exposed to COVID-19 just today, and I'm very close to the information, and I freaked out. I took her out of school. I told all the parents that I knew. Now she's in isolation, which means she was just playing in the pool. But I was, and I know all the information about everything, and I still all the information that I had, all the intellect and all the control, I still couldn't hold back from the nervousness and the panic. Um, so you sort of have to visualize what's going to happen in the moment when there's exposure. Visualization will help us to helps the highest athletes on the greatest levels to get to championships. So you have to envision what that'll be like. I would tell people that you have to prioritize what you're going to do. Meaning, like, if you can't put food on the table, so there's no shot that you're going to stay in isolation when you have a job. Like, you need that job. There's no shot. And I get that. Um, but an isolation and going into quarantine and all those things are really a kindness to somebody else, because at that point you already have the virus, and there's very little they can do for you, right? Because there's one therapeutic on the market, there's no vaccine. So you're just doing things for other people. You're isolating yourself and giving up your 14 days of pay and your mental health for other people. And the calculation is you versus other people, and there's nobody's going to blame anybody here if you come down on the side of yourself. because you have to take care of yourself. So I've come to the contact tracing conclusion in my business that I'm actually going to shift towards people who do care about themselves more than what the public health experts say, right? They want you to care about everybody, flatten the curve, we're all in this together, and I get that. But there are a number of people who it's not even a calculation for them. They have to care about themselves first. Um, and I'm designing my contact tracing around those people, right? Which means they're going to get a risk score, right? Um, there are scores out there that hospitals have produced on many levels: a risk of getting infected, a risk of having a severe infection, a risk of being hospitalized, right? So we are evaluating those risks. We're going to score people because it's in their personal interest to know how sick they're going to get. And if they're going to get very sick, or chances are high they're going to get very sick, so they will act accordingly from the beginning. But somebody who doesn't have a chance of getting very sick, we would give them advice based on who they are. So we're going to ask them to isolate, but at the end of the day, if we feel like they're wishy-washy and they're not going to do it, so we'll come up with a new plan for them, a workable plan for them, so that they can do as much as they can.
I think this approach is really interesting that you're doing, because a lot of what's out there right now, I'm no expert on this, but we're talking about numbers and issues and what we do know and what we don't know, but it seems like you're getting more into that mentality and emotional state of people and saying, listen, you can tell someone X, Y, and Z all you want, but if you can't figure out how to work with people that may or may not be willing to make adjustments to their lives and take that variable into consideration, it might be difficult. So it seems like you're trying to find a different route that tries to use as much information that's out there while also understanding the human being.
Right, exactly. That's what we're trying to do. And it's very difficult because everybody's different, and everyone has and you're talking to a total stranger, and all of a sudden you have to open up and you have to tell them everything about your life. It's a very difficult thing for everybody. I'll tell you that there's a lot of evidence that this would work. New Zealand is the only country in the world that is officially virus-free. They quashed the virus. There's not a single virus on their island. And they put out a study that said two things. The speed of how you contact people is crucial, but that is almost the only thing that the world is caring about right now. The second thing which they cared about is the effectiveness of isolation. And that's what we're talking about right now. We don't think that, for several reasons, people will want to stay isolated. There's a huge economic problem. Okay, there is, like we already talked about, there's a social problem. There's the mental health aspect. Okay, and those are almost side factors. Then there's the main factors, which are 40% of the spread comes from people that don't know they have symptoms. So if there's nothing wrong with you and some person you don't know is telling you to stay home, why would you do it? Like, they're probably wrong, and you'll be right to think that they are wrong. The stats are coming out that we are over isolating most people. Depends on where you live, but we are asking people a lot of people to isolate and to quarantine. Now, those are preliminary stats from studies that aren't peer reviewed. So don't go making the mistake and quoting me there. But what I'm trying to say is that this isn't a perfect science yet on who needs to be isolated and who doesn't need to be quarantined, and we're trying to work those things out. In the meantime, we're casting a wide net, and it's catching a lot of people in there. So if you don't have symptoms, why would you stay at home, right? That's 40%. Then you have the tests are about 30% wrong, 70% right. So even if you get tested, we're missing 30% of the people. You do the math on that, that's above 50%. So like more than 50% of people sort of in the weird space of we're not doing the right thing, we're not giving the right recommendations. Um, so you have to acknowledge those deficits, and you have to acknowledge that we're working with people and their finances are important to them. What we're doing is not an exact science right now. We're trying to catch up as best as we can in order to protect as many people as we can. But you have to make a personal decision at the end of the day. And we're trying to lay out on the phone, we're trying to lay out all those options for you so you can pick the best one for you. You can know exactly what the positives of what you're doing are, what the negatives of what you're doing are, and you take that risk.
And I think you kind of bring up an interesting point, like it's not an exact science because the science is still being figured out and developed right now, right? We're trying to do multiple things at the same time. We're trying to understand what this disease is, exactly how it's spread, if there's immunity or not. Can we create a medicine that can take it out or prevent you from having it? But at the same time, we're hoping to try and stop the spread. So you're adding plus everyone's own emotions and physical and economic state. Like it seems like what you're trying to do is do the best to bridge that gap and figure out how to make it work with what we know.
At the end of the day, it's a choice, and we're just trying to educate that choice. That's really exactly dead on. It's too complicated. People, are making their own judgment calls, and that's the way it should be, right? I mean, I don't think anybody should outsource their decision to the public health department.
So Adam, through all of this, you know, we're dealing with a lot of variables, and you're trying to narrow it down and see what works and what may not. And with that, it's hard to say what success is, but what will success look like maybe for you as an organization and the people that you help as you move through this?
We think that the normal standard of contact tracing that countries like Singapore, South Korea have achieved are not going to be the levels we're going to get in America. Um, we don't have enough discipline as a nation, and we've seen a lot of protests. There are different types of protests out there. There's the lockdown protest, there's the Black Lives Matter protest, and then there's like the Ozark Party protest, right? That was kids protesting. They didn't want to be locked down, so they went out and had a pool party. And all those are valid types of protests, and it's led us to feel and believe that lockdown is not going to work for many people. So what we're moving is past that. We're building our engine towards therapeutics, which means what medicines can be taken at home. How can we enable a hospital at home model to prevent uh, overflow of hospitals, right? Mild and medium symptoms in some countries are being taken care of at home. So we want to enable that to happen in those states. In certain states, whoever wants to do that. In states that want to stay open and want to prevent a further lockdown because they care about their economics, right? While being innovative on how to fight the virus. That's where we want to position ourselves. That's where we feel nobody's really taking the reins and giving people who want to stay open a way to do that. Because if you stay open, the virus keeps spreading. If you don't keep socially distant and put on masks, the virus keeps spreading. And it'll eventually overwhelm your hospitals. So we want to make a hospital to home model. Hospital to home is trademarked, by the way. I should say a different name, but that's the one that is used by other people. A hospital in your home model with technology from your phone to notify local infectious disease doctors. That way we can make sure that there's no hospital overflow, even though your state is staying open. We want to focus and give the isolation order only to the people that have the highest risk for serious symptoms, not the guy who's going to be asymptomatic or mildly symptomatic. Yeah, he's going to spread the virus, and we sort of have to, in our minds, we feel like the some Americans are coming to the idea that I'm going to spread the virus, but I'm not going to change my life. And so we want to accommodate those people, not tell them they're bad, not tell them they should be locked down. We want to, give them a service that will keep as many of those Americans alive, because they are equally in the right. There's maybe you think they're wrong, but they have a valid point, and we have to protect those Americans as well as the other Americans that are going to stay locked down.
It really seems like you are trying to be as open-minded about this as possible and being able to reach out to the general public and understand the backgrounds and where different people come from because, as this disease, this virus shows differently in different people, so too are those people different. And I think that I appreciate you coming on and talking about this.
It was great, man. It was like seventh grade all over again.
It was. Yeah, so that I should mention is Adam and I have known each other since middle school. I won't say how many years that's been. We're in different countries right now, even. But I saw Adam on LinkedIn doing some of this work, and I thought it was really interesting and reached out. And I've learned a lot from you already just in our conversations aside from this, and I hope that people watching are going to learn a little bit more too.
Thanks for the opportunity.